Hi.
There it is.
Nice to see you.
Thank you. Good to be here.
Thanks for agreeing to meet with me.
All right. I am in the lobby of a hospital right now. My son just had their third baby today. So I'm going
congratulations.
to visit my new granddaughter. Yeah, thank you.
How exciting.
Yeah, totally.
So I just have a few questions.
Okay.
Why did you come to the McDougall program?
Wow. Great. It's a long answer. I'll make a short answer out of it. So we read John's book in the 80s. And it was like too hard. My wife and I were like, yeah, whatever. We were vegetarians. We thought that was good enough. So why I did it now was because I had a heart attack a year ago, and they wanted to put me on statins and 3 other drugs, and the statin didn't go well with my joints. I was achy. So by this diet, I've been able to avoid the achiness of the statins. And then that was the 90% reason. And it's been great. So I did the course last July, right? So it's been 9 months. And yeah, I hadn't taken statins now in 4 months, and my blood tests have been great. My cholesterol's super low. So that's 90% of the reason. Then the other 10% was I just had, like, for probably 20 years, just chronically 10 pounds overweight. Like, couldn't figure out how to get rid of it, and did everything I could, blah, blah, blah. Nothing worked. This totally worked. I'm down to 155. I eat whatever I want within that parameter, whenever I want, as much as I want. And it's all good.
I love it. So you got what you were looking for.
I totally did. Home run in both counts.
So in the 80s, it was too difficult. How is it now? Is it hard? How?
Well, yeah, it's easier for me as an older man, because I don't care what people think now. I cared a lot that was, what was the 80s? That was like 40 years ago. I cared a lot what other people thought. And, I had a mother who was giving me input, and a father, and they both thought it was crazy. They even thought vegetarian was crazy. But, I just didn't want to rock the boat. I didn't have any bad health issues at the time. So the combination of those things. But now I don't care what people think. They can eat whatever they want.
So how have you been successful? I mean, what are you eating? How are you managing?
Oh, so we are like on the very simple end of what anybody that you've ever seen do, I'm sure, because I just rotate every 5 days, every 4 days. So it's, I have a potato-based day one day. We boil 2 pounds of potatoes, and we have them in a ton of different ways. Next day, like yesterday, I had rice, and we make rice in, for lunch and dinner. The third day I have, it's pasta. And then, with red sauce or pasta with anything. And then the 4th day I have leftovers. And then the 5th day I start over again.
I love that, though. That's what we teach, keeping it simple.
I know, it's so simple, Heather, because I thought, well, that'll never work because I'll be bored, right? But maybe it's because I'm 66, but I'm not bored. I don't want to have potatoes 2 days in a row, but I don't mind having them every 4th day. It's like totally fine. I'm like, I forgot all about potatoes. They're like a new thing.
I love that. Well, you look great. You look happy. You look like you're doing well.
Yeah, I am. Very.
What would you say to someone that's on the fence about signing up for a 12-day course?
Well, obviously they definitely need to do it. And I've been telling more and more people to do it. And they got to see the costs, right? So what I tell people is, well, you can eat like you're eating, but there's cost to it, and it'll catch up with you, if not this year, in 10 or 20 years, whatever. And it's just like, you're willing to pay that cost or take those risks. And then another thing I'd say is you can't bother what other people think about what you're eating, because it's your own life and your own health.
I love that. Well, thanks so much for your time, Jim. I appreciate it.
All right. Well, hope that was helpful.
Absolutely. Go enjoy that grandbaby. Congratulations.
All right,